Have you ever looked in the mirror and thought, I feel fine, but something just feels a little off lately? Maybe your energy isn't what it used to be. Maybe you're noticing small changes, dry skin, sore gums, an odd smell, or a tiny cut that's taking longer than usual to heal. Here's a question most people over 60 don't ask often enough. Could my hygiene habits be telling a deeper story about my health? You might be surprised to hear this, but doctors can often spot serious health problems just by observing small hygiene issues. It's true. These aren't the kind of things most people ever think twice about. Yet for a trained eye, they can be early warning signs. Quiet little red flags of something much more serious going on inside your body. And the truth is, many older adults go years doing the same routines, believing they're just getting older, when in fact, a few small changes could dramatically improve their quality of life, and maybe even save it. In this video, we're going to have a real heart-to-heart. Not about fancy medical terms or complicated routines, but about simple things. The kind of things you can do right in your bathroom, or sitting on the edge of your bed. 7 common personal hygiene mistakes that many seniors make without even knowing it, and more importantly, how to fix them. Let's start with a simple but powerful one. Your mouth. When's the last time you really paid attention to your toothbrush? Not just whether it's sitting there in the cup, but really looked at it. Is it old and frayed? Are you brushing twice a day, honestly? And even if you are, do you know that brushing alone might not be enough? I want to tell you about Linda. She's 70, retired from teaching, sharp as a tack, and she loves her crossword puzzles. But for months, she ignored her bleeding gums. That's just part of aging, she told herself. It wasn't painful. Just a little blood in the sink now and then? Nothing to worry about, right? Well, it turned out that bacteria from her gums had been entering her bloodstream, quietly, slowly, causing inflammation around her heart. When her doctor found it during a routine checkup, he told her point blank, if we hadn't caught this now, it could have been fatal. That's how serious oral hygiene can be. If your toothbrush is more than 3 months old, it's time to toss it. Better yet, consider switching to an electric toothbrush. They clean more thoroughly and are especially helpful if you have arthritis or shaky hands. Make brushing twice a day a non-negotiable. Set a timer for 2 full minutes. It feels long at first, but your gums and heart will thank you. And don't skip the floss, even if it's annoying. Flossing gets where brushes can't, places where dangerous bacteria love to hide. And don't assume dentures mean you're off the hook. Your gums and tongue still need regular care. A soft brush and routine dental visits matter just as much as ever. Now, let's move from your mouth to something that often gets skipped. Bathing. I get it. Bathing can feel like a chore, especially in winter when the bathroom's cold or your skin feels dry. But here's what you may not realize. Your skin is your largest organ, and it often tells the first story about what's going on inside you. Doctors have spotted early signs of diabetes, liver disease, even kidney problems just from changes in a patient's skin. But when bathing becomes infrequent, these clues get missed, not only by doctors, but by you. Let me share George's story. He's 76, a retired truck driver who prided himself on being tough. During the colder months, he started bathing just once a week. I wasn't even sweating, he said. Didn't see the point. But his skin started developing unusual patches, dry, discolored, slightly itchy. He chalked it up to dry air. When he finally brought it up to his doctor during a visit for something completely unrelated, they ran some tests and discovered early-stage kidney disease. The changes in his skin were his body's first cry for help. Bathing at least 3 times a week isn't just about staying fresh. It's about staying aware. Use gentle, fragrance-free soap. After bathing, Pat your skin dry and moisturize while your skin is still slightly damp to lock in hydration. And here's the most important part. Take a moment to really look at your skin. Not just your face and arms, but your legs, your back, even between your toes. Any strange discoloration, flaky patches, new spots that itch or hurt? These are clues. Your body talks to you. You just have to listen. Now let's talk about something we often ignore completely. Our nails. Take a quick look at your fingernails. And if you can, your toenails too. Are they clean? Trimmed? Do they look a bit thick? Yellow? Maybe a little brittle? You'd be amazed how much a doctor can learn from your nails. In fact, research shows that nail changes have helped doctors diagnose anemia, thyroid problems, even heart disease in seniors who had no other symptoms yet. Take Margaret, for example. She's 82 and used to love wearing sandals in the summer. But over time, her toenails got thicker and yellowed, so she started hiding her feet in closed-toe shoes, even on the hottest days. Just getting old, she shrugged. But when her feet started hurting, she saw a podiatrist. He immediately recognized the signs of a fungal infection. That was just the surface problem. Further testing revealed her immune system had been severely weakened, putting her at risk for much more serious conditions. If your nails are changing, color, texture, thickness, it's time to pay attention. Trim them straight across. Keep them clean and dry. And if something looks off, don't wait months to have it checked. It's not just about appearance, it's about your health speaking to you through your hands and feet. Now let's pause here for just a moment. We've talked about your mouth, your skin, your nails, things we often assume are just part of getting older. But the truth is, your body is incredibly smart. It's sending you signals every day. And when you know what to look for and take action early, you're not just protecting your health. You're protecting your independence, your energy, and your peace of mind. Let's talk about something that hardly anyone wants to mention. Yet over half of seniors are silently dealing with it every day. Bladder leakage. Now, before you click away or feel embarrassed, I want you to know you're not alone. And this conversation might be one of the most important ones we have. Many people think a little leak here and there is just part of getting older. So they grab a paper towel, wear dark clothes, maybe bring a change of pants, just in case, and they keep it quiet. But here's the problem. When incontinence is ignored or hidden, it doesn't go away. It gets worse. And worse still, it often hides something much deeper. Sometimes a bladder condition, sometimes a prostate issue, sometimes even early signs of cancer. I remember Frank, a 73-year-old retired accountant who prided himself on being in control of everything. His finances, his schedule, his life. But when he started noticing some light leakage, he was too embarrassed to talk about it. He started using paper towels in his underwear and packing extra clothes when he left the house. For a while, he thought he had it under control. Then he developed painful sores. And by the time he finally saw a doctor, the infection had spread. What shocked him even more? The underlying cause wasn't just aging. It was an advanced prostate condition that could have been treated far more easily months earlier. I almost waited too long, he told me. And for what? Pride? Here's what you need to know. Urinary incontinence is not something to be ashamed of. Doctors deal with it every day, and there are so many effective ways to manage it that don't involve hiding in silence. If this sounds familiar to you, the first step is to talk to your doctor. Use real medical-grade absorbent products, not tissues or makeshift fixes. Change them often, keep the skin clean and dry, and gently cleanse the area after each episode. Most importantly, don't wait. If you're mapping your day around the location of bathrooms or wearing backup clothes just in case, your body is trying to get your attention. Listen, let's move on to something you probably haven't thought about in years: your ears. Now, if you've been cleaning your ears with cotton swabs, I need you to stop. Right now, I know, it's how most of us were taught to clean our ears. But here's the truth. Inserting anything into your ear canal, even something soft like a swab, can do serious damage. Doctors see this all the time. I spoke with Susan, a 71-year-old retired librarian, who always kept her ears squeaky clean. Every morning after her shower, she'd grab a cotton swab and dig around a little. One day, she felt a sharp pain, and then nothing. No sound in one ear. She'd punctured her eardrum. It led to a painful infection, multiple doctor visits, and permanent hearing loss in that ear. And the worst part? It was entirely preventable. Your ears are self-cleaning. They really are. The wax exists to trap dirt and move it out naturally. If you need to clean around your ears, use a warm, damp washcloth and stick to the outer area only. If you feel like there's a buildup or blockage inside, don't try to remove it yourself. There are safe eardrops that can help soften the wax. But it's always best to have your doctor check first, especially if you're noticing any pain, ringing, or hearing loss. Your hearing is too important to risk. It connects you to your loved ones, to music, to memories. Protect it. Now, while we're on the topic of things we often overlook, let's talk about your feet. When was the last time you really examined your feet? Not just glance down while putting on your socks, but actually check the bottoms, between the toes, your heels. Your feet carry the weight of your entire body. And as you age, they become the first place where serious conditions start to show, like diabetes, nerve damage, and poor circulation. I'll never forget Robert, a 76-year-old former factory worker who came in for an annual checkup. His doctor noticed some dry, cracked skin on his heels and a small cut that wasn't healing. That cut? It was a clue. After a few simple tests, they discovered Robert had early-stage diabetes. He'd had no idea. No fatigue, no thirst, no other symptoms, just that one little wound that wouldn't close. Diabetes-related amputations are far more common than people think, especially among seniors. But here's the hopeful news. Up to 85% of them can be prevented with simple foot care. So let me encourage you. Wash your feet daily with warm water and gentle soap. Dry them thoroughly, especially between the toes, where fungus loves to grow. Apply moisturizer to dry areas, but avoid the space between the toes. If you notice cracks, discoloration, numbness, or sores that don't heal, don't wait for your next routine visit. Call your doctor. Wear clean, breathable socks. Check your shoes for fit and pressure points. And if bending down is tricky, ask for help. Your feet are worth it. I know we've covered a lot so far. Your mouth, your skin, your nails, your bladder, your ears, and now your feet. And maybe you're thinking, that's a lot to keep track of. But the truth is, these aren't chores. They're check-ins. They're small acts of self-respect and ways you can partner with your body instead of working against it. Because here's the thing. Your body isn't giving up on you. It's still talking, still fighting, still trying to take care of you. All you have to do is pay attention. And there's one more hygiene issue I want to talk about. It's one that sneaks up on even the most health-conscious people. It hides in plain sight. You do everything right, eat well, stay active, bathe regularly, but something feels off. You've got dry mouth, maybe an unusual body odor, or you're sweating more than usual even when you're not doing much. The culprit? It might not be you at all. It might be your medications. The truth is, many medications come with side effects that can affect your personal hygiene, without you even realizing it. Nancy, a 67-year-old retired nurse from Florida, had always taken good care of herself. She bathed daily, used deodorant, kept a clean home. But her daughter started noticing a strange body odor that hadn't been there before. Nancy was embarrassed. She doubled down on showers and changed her laundry detergent, thinking maybe that would fix it. But nothing worked. It wasn't until her routine physical that her doctor connected the dots. The odor wasn't coming from poor hygiene, it was coming from inside her body. A new medication she'd started a few months earlier was slowly affecting her liver. Thankfully, the doctor caught it in time. They adjusted her prescription, monitored her liver function, and Nancy made a full recovery. But the odor had been a sign, a signal. This happens more often than people think. Some medications can cause dry mouth, excessive sweating, or body odor because of how they interact with your organs, or how your body processes them. So if you've recently started a new prescription and you're noticing a change, your breath is different, your sweat smells stronger, your mouth is always dry, it's worth tracking. Start a simple journal. Nothing fancy. Just jot down any changes in your hygiene or how you feel physically after starting or changing a medication. And share it with your doctor at your next appointment. Don't assume it's just aging. Your body may be reacting to something and it deserves to be heard. And please, never stop or adjust your medications on your own. Always talk to your doctor first. They want to help and they have safe ways to make adjustments if needed. Now take a breath. We've covered a lot together. But every single point, your mouth, your skin, your nails, your bladder, your ears, your feet, and even your medications, they all share one simple truth. Your body is always trying to tell you something. And when you listen, really listen, you give yourself the power to prevent serious problems before they start. You protect your independence, your dignity, your time with your grandchildren, your garden, your morning walks, your bridge club, your book circle, whatever it is that makes life feel like your life. None of this is about being perfect. It's about being aware, being gentle with yourself. So here's what I want you to remember. You are not fragile. You are strong and smart and still in control of more than you think. It doesn't take grand, sweeping changes. It takes small, consistent ones. A new toothbrush, one extra bath this week, looking at your feet before bed, flossing tonight, bringing up that little leak to your doctor, switching from cotton swabs to a warm cloth, writing down how that new pill makes you feel. Each one of these steps is a message to your body that says, I'm listening, I care, I've still got your back. And maybe, just maybe, one of these steps could save your life, or the life of someone you love. So, I want to ask you something. Have you ever experienced one of these hygiene issues and realized later that it was something more? Or maybe you're currently dealing with one of them and didn't realize how important it might be until now. Share your experience in the comments below. Your story could help someone else feel less alone and more empowered to take action. If you found this video helpful, please give it a thumbs up. And if you haven't already, hit that subscribe button and tap the notification bell so you don't miss future videos. We share tips, encouragement, and real conversations just like this. Because living well after 60 isn't about slowing down. It's about living smarter, staying aware, and embracing this chapter of life with confidence. You deserve to feel strong. You deserve to feel seen. You deserve to feel good in your own skin every single day. So here's to you, to your strength, your wisdom, and your continued health. Here's to living your best life at any age. Thanks for spending this time with me. I'm proud of you. Truly. And I'll see you in the next video.